Hey Cindy, how are you doing today?
Good, how are you?
I'm good. I'm going to hand you a mirror
Okay.
and tell me a little bit about what your concerns are today.
Well, I just feel like my eyes are getting a little, droopy,
Mhm.
heavy down there. Obviously the wrinkles up here. So maybe something to, I don't know if it'll pull it up some. Getting the wrinkles in here and down in here. I just kind of, this is my first time, so I'm a little bit you to tell me.
So you haven't had any injectables before?
No.
Okay.
No.
Well, Botox typically is used for the upper part of the face. There's definitely places on the lower face that it can also be used for, but traditionally it's to relax muscles in the upper part. We want to focus on giving you a rested look, not just erasing every line on your face, because versus being frozen, we want you to look refreshed, relaxed, happy, all those things.
Okay.
And a little bit of movement's not a bad thing.
Okay.
Botox is determined by the strength of your muscle movement. So we want to use the knowledge and experience that we have to achieve the correct amount so that you get the desired result. So now I'm about to have Cindy make some facial movements so that we can decipher how much Botox she needs to achieve the desired result we're looking for. Okay, I'm going to have you raise your eyebrows. I'm just going to reline these little places for spatial purposes. Okay, now let's have you give us a big scowl, like an angry face. Look at me. Okay, you can relax that. And then a big smile. And close really tight like you're squeezing your eyes closed. Perfect, thank you. Okay, Cindy, we're just going to remove this numbing cream for your face now, so I'm just going to let you relax back. After we get the actual cream off, we're going to prep your skin with a little bit of alcohol and then a little pivot cleanse just to make sure we have a nice, clean, germ-free surface. Okay, we're going to start with the Botox injections now. We already have Cindy's forehead marked out, so I'm going to follow my pattern there so she can just relax. Tiny injections. We use an insulin needle in these areas. It's ultra fine, super painless. People don't even need numbing for that. They can literally pop in on their lunch break, get these injections done, be back at the office, no problem. We use BOTOX Cosmetic by Allergan here. There are a few other neurotoxins that are on the market, but this is our pick of choice. Now we're going to do between Cindy's brows, which is traditionally known as the glabella area. I will have her make expressions for this so I can see exactly where the muscle is. Big scowl for me, Cindy. Okay, and relax. This injection will go a little bit deeper so that it gets right in the belly of that muscle. Scowl for me again, and relax. This is also the muscle that's going to give her that lift and relaxed look between the brows. Okay, we're having you turn this way. I want you to close really tight like you're squeezing your eye closed, and relax. We're looking for the upper part of that crow's feet muscle so that we can get as much little lift for a rested look around her eyes. Big smile again, and relax. And I really don't want to take away all of the lines around her eyes. I just want to soften it so she has that nice relaxed look. If people do want to remove all their crow's feet, they can, but that's not what we're going for here. Now that we have completed the Botox for Cindy, we're going to move on to using a filler, Juvederm Voluma, to volumize her mid-face. Once her mid-face is volumized, we're just going to soften a little bit of her lower face with Juvederm Velour. Alright, here we go, tiny little stick. So we're going to go all the way down the periosteum. I'm just going to do a little check, make sure we're not in any veins for a flashback. And then we're going to inject a tiny bolus right onto her cheekbone because we want to follow the natural contour of Cindy's face. I'm not trying to change anything, just give her back what she has lost. Okay, we're going to add a little bit of volume to this side as well. Once again, a little aspiration, make sure we're safe. Okay, so final injection. we're gonna add a last syringe of Juvederm Velour. We're just gonna soften these little lines right through here and a little bit of that chin crease, just to make this just look a little bit smoother. As you can see, her lines here are already smoothed out just from getting that lift, and we have the volume kind of back in the right proportion of her face. This injection technique is a little different, Cindy, as it's a threading technique. I am moving the needle around a little bit more.